to protect yourself effectively against the coronavirus. Are face masks really effective against the coronavirus infection? The new coronavirus has been a serious threat to global health over the last 3 months, and recent statistics show that the world is nowhere near a possible remission from this epidemic. In January 2020, there were over 7,800 infected cases, affecting 18 countries in 4 continents. 99% of these cases were from China, which was so far the only country with reported cases of deaths. Towards the end of February 2020, while global and national health organizations thought the epidemic was already under control, things got worse. The number of cases, deaths, and affected countries changed drastically. The World Health Organization reported over 80,000 infected cases globally, now affecting more than 52 countries, including the first 2 African countries, with death toll going as high as 2,800, with other countries being involved, not just China. In March 2020, updates reveal that 6 countries in Africa have already confirmed cases of this virus. With all these escalating statistics, should we still rely on face masks for the prevention of this epidemic? Again, are face masks really effective against coronavirus infection? What are the other preventive measures that can help against the spread of this virus? In this video, we'll be showing you 7 basic protective measures against the COVID-19. If you're new on Healthy Habits channel, where we give you the latest and surest health facts, you can consider subscribing so that you will receive a notification whenever we put a new video online. Before we start, you must understand that there is nothing wrong in putting on a face mask to prevent the spread of the coronavirus. The virus is transmitted through respiratory droplets from person to person, making face masks important here. But should we all be wearing a face mask all day long? Here is what the Center for Disease Control has to say about wearing of face masks. Firstly, it is not recommended for people who are well to wear a face mask to protect themselves from respiratory diseases, including the COVID-19. Secondly, face masks should be used by people who show symptoms of the COVID-19 to help prevent the spread of this disease to others. The use of face masks is also crucial for health workers and people taking care of others in closed settings. It could be at home or in a healthcare facility. But hey, people have been using face masks ever since this whole thing started, and the number of cases keep on increasing. This shows that wearing face masks is not enough. So these are the other protective measures given by epidemiologists and health experts that you can start implementing as from now. 1. Wash your hands as often as you can. Effective hand washing should be done with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, after blowing your nose, coughing or sneezing, when caring for the sick, when hands are visibly dirty, and after handling animal waste. This is very crucial in disease prevention because most people get infected by coming in contact with or touching a surface that was once touched by an individual infected with the COVID-19. These surfaces could include office working tables, supermarket counters, door handles, control parts of elevators, and many others. So guys, if we must stop the spread of the COVID-19, hand washing is indispensable. Please do it as often as you can. 2. Clean and disinfect frequently touched objects and surfaces. If you understood why hand washing was necessary, then it's obvious that this is the next thing to do. Good general hygiene is also essential. Keep places clean and tidy. Remember to ventilate regularly to renew the air. Use soapy water, possibly white vinegar or diluted bleach. Remember to clean the objects you use and handle every day, like your mobile phone, for example. 3. Avoid touching your eyes, nose and mouth. Our hands touch many surfaces per time and can pick up viruses all day long. Once contaminated, hands can transfer the virus to your eyes, nose or mouth. From there, the virus can enter your body and can make you sick. This is why you may want to avoid touching your eyes, nose and mouth for no valuable reason. Little question. Do you think the coronavirus can be transmitted through kissing? Please drop your answers in the comment box. 4. Maintain social distancing. This simply means avoid close contact with people who are sick. Yes, this is very serious, people. Try to keep a distance of at least 1 meter or 3 feet between yourself and anyone who is coughing or sneezing, because when someone coughs or sneezes, they spray small liquid droplets from their nose or mouth, which may contain the virus. If you come very close to them, you can breathe in the droplets, including the COVID-19 virus, if the person coughing has the disease. 5. Practice good respiratory hygiene. Good respiratory hygiene means covering your mouth and nose with your bent elbow or tissue when you cough or sneeze. Then dispose the used tissue immediately. Make sure you and the people around you follow good respiratory hygiene and cough etiquette. 6. Avoid crowded places, especially hospitals. To reduce the risk of being exposed to this virus, it is recommended to avoid crowded places and gatherings. Hospitals are also to be avoided as much as possible for obvious reasons. If you must go there, strictly observe hygienic measures. 7. Seek medical care early in case of fever, cough, and difficulty breathing. Local authorities will have the most up-to-date information on the situation in your area. Calling in advance will allow your healthcare provider to quickly direct you to the right healthcare facility. Stay home if you feel unwell or if you have a fever, cough, or difficulty breathing. Please seek medical attention and call in advance. Follow the directions of your local health authority. These will also protect you and help prevent spread of the virus and other infections. So that's it, guys. The prevention of the coronavirus infection goes far beyond just wearing a mask. There is currently no vaccine to prevent coronavirus disease 2019 or the COVID-19. The best way to prevent this illness is to avoid being exposed to the virus. Stay informed on the latest developments about COVID-19. Follow advice given by your healthcare provider, your national and local public health authority, or your employer on how to protect yourself and others from the COVID-19. They are best placed to give you advice on what people in your area should be doing to protect themselves. Thank you guys for watching. Don't forget to hit the like button and to share this video with your friends and family to help keep them safe. Also, subscribe if you haven't done so. And hey, I think it's time to go wash your hands.